TMJ or TMD, TMJ is actually just an anatomical place. It's temporomandibular joint, okay, which is how we open and close our lower jaw, and it goes downward and forward and then goes back into its position when we close. TMD, temporomandibular disorder, is kind of more what I call that situation, but it really has three components, okay? You've got a teeth component, you've got head and neck muscles component, and then you have the actual joint space itself, okay? And so a lot of times patients come in and say, I have TMJ, or, Dr. Z back in the day told me I had TMJ and they made me this, guard or something. Yes, sometimes that can be helpful, but I think you got to understand like what's going on. Again, the risk factor, what's going on. Do they have TMD issues going on because they have a airway or breathing underlying condition, right? Over the years with all my training, I've really learned that the airway and sleep, dentistry or obstructive sleep apnea, those things really play closely with TMJ issues and TMD issues, because byproducts of having that issue and not being treated for it creates TMD and TMJ issues. I see that, right? Extra wear on the teeth, right? Generally, we start to see visual signs in the mouth on the teeth first. And we can see worn areas on the teeth, or maybe we see teeth that have resection, right? Where the gums have shrunk. Or maybe there is attrition is what we call it, which is just wear, but abfraction. Abfraction is where you actually have little notches out at the gum levels of the teeth, and you start to lose tooth structure there because of some of the forces, lateral or side-to-side forces that are placed from the opposing teeth. And so being understanding of all that and being able to have a good exam and look clinically is really important. The second component of it is the muscles. You got to understand how these muscles are so powerful. I mean, I've seen a lot of patients over the years and, come in and they've said, well, I've been treating, trying to be seen by the neurologist and all of these different medical professionals because they have these challenges. They might have facial pain. They might have recurring headaches. They might have migraines. They might have cervical things going on, head and neck issues going on. What I've learned is that there's a whole lot of things that are really dependent on this right here. This is kind of the center of our core, all right? Our head and our neck, our bite, how all this functions is really, really important to our total body health, because at the end of the day, if somebody comes in and they're in pain or discomfort or having, head and neck issues, like they just want to feel better. And I mean, I've had people come in and they're in tears in the practice before, right? Because they have such an acute episode, or maybe it's gotten so bad where they can only open a certain distance, right? I mean, that's really, really tough way to live, and quality of life is greatly diminished. And so understanding that those three things are really key components, and I say it's a triad, a triangle, or it's a bucket. Once we start to have wear on the teeth, the next thing that spills over generally is the muscles, and then you start to have muscles that are not behaving like they need to. Knots in the muscles, trigger points, which can refer pain in areas. And so really understanding that, it has a great deal of how you can help somebody who has, TMJ issues or TMD issues when they search you out and come in your practice. Again, understanding the etiology of it and why that somebody's doing it is really important. So we're always going to look at airway to see if there's any challenges with airway or sleep breathing, first and foremost. We'll either rule that in or rule that out. Secondly, I want to understand how the teeth, because if we've worn down some teeth over the years, it's kind of like our vehicles. Sometimes there can be an alignment issue with the vehicle, right? And we don't understand that at the time, but we take it in and they hook our car up to a computer, and the guys at wherever we go to, Firestone or wherever we choose to go to, says, hey, you've got an alignment issue. I can help this uneven wear on the tires, but we're going to need to align the vehicle. And so that's how I think about our head and neck and our teeth and our jaw muscles, is sometimes we have a misalignment with our teeth, the way that we've worn things down. Another thing that we'll do here in the office is to look at the actual way that the teeth come together. So the way that the teeth come together when you close down, and then when you function. So we mimic right and left movements in the jaw, and then forwards and backwards. And so understanding that and doing a digital bite scan gives us some actual diagnosis and something to kind of quantify. And so it's called the tech scan. I've been trained with this a long time ago, and it's phenomenal for me to understand really what's going on. I mean, I can take some marking paper and have somebody tap, tap, slide, slide. Okay, which tooth do we think that is causing this problem, right? At the end of the day, I'm just using the knowledge from past experiences and my best guess on that. But this is real data where we're hooking it up to a computer. It is measuring the bite forces down to microns. And so we understand that when we slide left and right, and forwards and backwards. If we have teeth that are interfering or hitting on each other or dragging on each other more, it's going to disrupt the whole system. The muscles continue to fire, the muscles don't shut off, they can't relax. Eventually, when that happens and when these muscles get overworked, it produces these symptoms that start up for patients. And so understanding things that we can't necessarily see with regular marking paper and lights and loops is a very, very key way that we use to diagnose and treat. And then we can take that information, then we can go in and make some corrections and kind of do like an alignment, a better alignment. I call it bite optimization for patients, but you're basically getting the bite forces to be more in line with where they need to be, and then getting the timing of the teeth, making sure that you're not hitting on the right side or left side first and then sliding to get all the teeth to close. And so it basically aligns the teeth, and believe it or not, we have so much proprioception in our mouth that off just a little bit can really disrupt the whole system. And so we have patients that come in, and once we are able to do that, they have a lot of their symptoms that go away: the hypersensitivity, the soreness, the facial pain, the headaches. And so that's a key thing. Also, sometimes just doing some splint therapy where we make a customized appliance for the patient to protect the teeth if they have parafunction. When I say parafunction, that's clenching, gritting, or grinding. And again, going back to what I said earlier, it's important that we understand that, is there an airway issue going on? Is there a sleep issue going on at nighttime? So we want to rule that in or rule that out, but then an appliance can be made, right? And this is an appliance to help decrease the stress and strain from the upper teeth and the lower teeth, to help eventually relax these muscles as well, and to protect restorations that have been done, natural teeth, or a combination of natural teeth and restorations that have been done. So there's a lot of techniques. We also use lasers to treat our TMD issues, and we've got specific lasers that can help with inflammation, pain, swelling, all these things. Where literally it can go in deep into the muscle, deep into the jaw joint itself, and can actually biostimulate healing and decreases of inflammation. And so that's something that's really cool that I love lasers for multiple reasons, but in this arena, you can literally have somebody, and a lot of times they may be recommended that they take medicines, and I've got a regimen for medicines when patients come in and they have inflammation and TMD symptoms, but also an option where they don't have to load up on a lot of medicine for a long period of time is lasers, and that can help at the actual site where the muscles are trigger pointed, where the jaw joint is sore, inflamed, clicking and popping, all those things.